Welcome to the Deep Dive.
Glad to be here.
Today we're jumping into some source material you've shared with us, focusing on a specific condition in dogs, canine eosinophilic pneumonia.
That's right. We've got quite a bit of information here, covering what it is, how dogs present with it, the diagnostic process, and then treatment and management.
Yeah, so our mission today is to really dig into this material and pull out the key takeaways. What exactly is canine eosinophilic pneumonia, or CEP? What signs should you look out for? How do vets figure it out when it looks like so many other things?
And importantly, what does the source material say about treating it? Strictly based on what we have here.
Exactly. We'll walk you through the essentials, the diagnostic puzzle, the management path, all drawn directly from these sources.
Okay, let's get started.
All right, first things first, the basics. What fundamentally is canine eosinophilic pneumonia according to this source?
Well, the source defines it as an inflammatory response. It happens down in the lung tissue itself, the parenchyma, and also in the airways. And the defining feature is this buildup of eosinophils.
Eosinophils. Those are a specific type of white blood cell, right? Associated with allergies or parasites.
Exactly. So you get this exudation, basically a leaking out of these eosinophils and fluid into the lung tissues and airways. It points towards an immune system cause.
Okay, so the immune system is involved. Does the source elaborate on how?
It does. It emphasizes an immunologic basis, though it also notes the exact mechanisms aren't, completely worked out. But the evidence, like finding lots of eosinophils in fluid washed from the lungs, suggests a specific type of immune reaction, probably a Th2 dominant response, is happening in those lower airways.
Like the immune system is overreacting to something.
Precisely. It's reacting to some kind of antigen, some trigger. And the source says these triggers can get into the lungs either by being inhaled.
Like pollen or dust?
Yeah, or they can arrive through the bloodstream. This seems to set off a kind of chronic immune response involving antibodies like IgE and IgG, and potentially issues with how the immune system regulates itself. It even mentions increased enzyme activity that could damage tissue.
And is it always the same kind of inflammation, or does it vary?
It can vary. The source actually breaks it down into a few patterns. There's eosinophilic pneumonitis, which is more in the deep lung tissue.
Okay.
Then eosinophilic bronchitis, focusing on the airways, the bronchi. And pulmonary eosinophilic granulomatosis, that's when you get distinct inflammatory nodules or granulomas. Severe cases can have quite a lot of this granulomas change.
Granulomas, like little balls of inflammation?
Sort of, yeah. Nodular lesions. And there's also a specific link mentioned with heartworm disease.
Right, you mentioned that. How does that work?
Well, the source explains that the microfilaria, the baby heartworms, can get stuck in the lung's blood vessels. When that happens, they can trigger the specific eosinophilic immune response, usually leading to that pneumonitis pattern we talked about.
Interesting. So it's mainly a lung problem, but can it affect anything else?
Primarily the lower respiratory tract, yes. Lungs and airways. But the source does note the nasal cavity can sometimes be involved too, and if the lung disease is really severe and chronic, it can put a strain on the heart.
Leading to heart problems.
Potentially, yes. A condition called cor pulmonale, which is right-sided heart failure caused by lung disease.
Got it. And who gets this? Any particular dogs?
It seems to be pretty widespread geographically. The source mentions a possible increased risk in Siberian Huskies. But it's most often diagnosed in young adult dogs, say around 4 to 6 years old. No difference noted between males and females.
Okay, so that covers the what and where. But what would an owner actually see? What are the signs if your dog has this?
Yeah, that's tricky because the source stresses the signs are extremely variable. It really depends on how severe the inflammation is and exactly where it is.
Makes sense. Mild bronchitis probably looks different from severe pneumonitis or those granulomas.
Definitely. Looking at the history, what owners report, a cough is really common. And often it's a cough that maybe didn't respond to antibiotics, which might have been tried first.
Okay, a persistent cough.
Yeah.
What else?
Things like labored breathing, or maybe the dog just gets tired really easily during walks or play exercise intolerance. Loss of appetite, seeming lethargic or down, weight loss. Those are all possible. Sometimes nasal discharge, too.
And what about fever? You'd think inflammation might cause a fever.
That's a key point. The source makes fever is actually uncommon with CEP.
Good to know. So if a vet examines a dog they suspect might have this, what would they find?
Well, they might hear that cough, often described as harsh and maybe moist sounding. They might see the dog breathing fast, dyspnea, or showing obvious difficulty breathing.
And listening to the chest.
Auscultation, yeah. Breath sounds can be abnormal. sometimes louder than usual, or they might hear crackles, which are sort of popping sounds, or wheezes, those whistling sounds. Sometimes, if it's really severe, the breath sounds might actually be quieter than normal, muffled. And they might notice weight loss, or if there's nasal discharge, it's often described as yellow-green or thick, mucopurulent. And again, the source reiterates, fever is generally not a feature.
That lack of fever really stands out as a diagnostic clue, doesn't it?
It definitely helps differentiate it from some purely infectious pneumonias. Yeah.
Okay, so we know what it is, what it looks like. What does the source say actually causes this immune reaction?
It points to two main camps for the triggers, the purported causes. First, things inhaled from the environment, aeroallergens.
Like what specifically?
Things like fungal spores, maybe mold elements, pollen, bits of insects, dust mites, storage mites, or sometimes it's just an unidentified immune trigger in the air.
So basically, allergies hitting the lungs.
In a way, yes. And the second group is parasitic antigens.
Heartworm again.
Heartworm, microfilaria are the big one mentioned, definitely. But also antigens from other parasites that might live in the respiratory tract.
Are there factors that make a dog more likely to hit this? Risk factors.
Yes, the source lists a few. A big one is living in a heartworm area without being on regular preventive medication. That ties right back to the microfilaria.
Makes sense. Prevention is key there.
Absolutely. Also, living in a very dusty or moldy environment, that increases exposure to those potential aeroallergens. And air pollution is also mentioned as a possible contributing factor.
So environment and preventive care seem pretty important.
Okay, now for the tricky part, diagnosis. How do vets actually pin this down, especially since the signs overlap with so many other illnesses?
Yeah, the source really emphasizes this. It lists a whole bunch of differential diagnoses, other things it could be, other kinds of pneumonia, parasitic, fungal, bacterial, viral.
Right, but also congestive heart failure, chronic bronchitis, even things like lung tumors, or maybe the dog inhaled something, a foreign body.
So step one is ruling a lot of things out. What tests help with that?
Lab tests are usually a starting point. A CBC, the complete blood count. You might see signs of inflammation, what they call an inflammatory leukogram.
Meaning changes in the white blood cells.
Exactly. Maybe high neutrophils, sometimes immature ones, a left shift. And often, you do see high numbers of eosinophils in the blood. Sometimes basophils or monocytes too, other cells involved in allergy or parasitic response.
Okay, so high eosinophils in the blood points towards it.
It can, but here's a really critical point the source makes. You can have CEP even if the blood eosinophil count is normal. Their absence doesn't rule it out.
Wow, okay, that's super important. You can't just stop there if the blood count looks okay for eosinophils.
Definitely not. You have to dig deeper. On the chemistry panel, looking at organ function and proteins, sometimes you see high globulins, hyperglobulinemia. The source says this suggests chronic immune stimulation and should make you double-check for hidden heartworm disease, the kind without circulating microfilaria.
Are there other useful blood tests?
Arterial blood gas analysis gets a specific mention. It measures oxygen levels in the blood, showing how well the lungs are actually working. It's described as a sensitive way to track progress, too.
So it gives a number for how bad the lung function is.
Yes, the source gives ranges. Low oxygen, hypoxemia. Below 80 millimillireach G is mild moderate. Below 60 on room air is severe. It directly correlates with how disrupted the lungs are.
What about tests for the specific causes, like heartworm or other parasites?
Crucial. Specific heartworm tests, both for the adult worm antigen and for microfilaria, are needed. A positive result is obviously very significant. And fecal tests are recommended too, using different methods like flotation and Behrman to look for lungworm larvae. But the source adds a caution. A negative fecal doesn't completely rule out parasites because they might not be shedding larvae all the time. Sometimes vets might even try a dewormer just based on suspicion.
Right, empirical treatment.
Exactly. And one more lab test mentioned is protein electrophoresis, which can sometimes show a specific pattern, a beta-globulin spike that's often seen with that occult heartworm disease.
Okay, so labs give clues and help rule things out. What about imaging, chest x-rays?
Radiographs are really important, yeah. But what they look like depends a lot on the pattern of CEP and how bad it is.
So different patterns look different on x-ray.
They do. For eosinophilic pneumonitis, affecting the deep lung tissue, you might see an interstitial pattern. Think like a fine network or a general haziness. If it's severe, it can become an alveolar pattern, denser, cloudier patches with fuzzy edges.
Okay.
And if heartworm is the underlying cause, you might also see signs of that on the X-ray, like enlarged, twisty pulmonary arteries, or maybe an enlarged right side of the heart.
And for the bronchitis or granuloma pattern?
For eosinophilic bronchitis affecting the airways, you'd expect to see a bronchial pattern. The airway walls look thickened. Vets sometimes describe them as looking like tram tracks or railroad tracks side-on, or donuts if you see them end-on.
Ah, okay, those visual descriptions help.
Yeah. And in really chronic bronchitis cases, the airways can get permanently widened, which is called bronchiectasis. For the granuloma pattern, you might see actual nodules on the X-ray, or patchy densities, maybe even enlarged lymph nodes in the chest.
So X-rays give a picture, but might not be definitive alone. What about getting samples directly from the lungs?
Exactly. Often you need more invasive procedures to really confirm it, especially to confirm those eosinophils are in the lungs or airways.
Like what kind of procedures?
Things like a transtracheal wash or an endotracheal wash. Collect fluid samples from the larger airways. Bronchoscopy is another one, using a small camera.
Going down into the airways with a camera?
Yes. It lets the vet see directly. The source says they might see thick yellow-green mucus, swollen airway lining, maybe even airways collapsing partially. Sometimes they can even spot eosinophilic plaques or granulomas right there.
Wow.
But the procedure that's really highlighted for getting a definitive diagnosis is bronchoalveolar lavage, or BA.
BAL, what's that?
It involves washing a small part of the lung with sterile fluid and then sucking that fluid back out. Then you look at the cells in that fluid under a microscope cytology.
And that's where you find the eosinophils.
That's often the key, yes. If the cytology shows that eosinophils are the main inflammatory cell type there, that's considered pretty definitive for CEP, according to this source. They also look for other things in the fluid, like signs of parasites or fungi, and the source recommends culturing the BAL fluid too.
To check for bacterial infection.
Right, because you can have a secondary bacterial infection on top of the CEP, so the BAL is really crucial.
Any other diagnostic tools mentioned?
Fine needle aspiration of the lung is mentioned as another way to get cells. Allergy testing, skin tests, or blood tests gets mentioned too, but with a caveat. The source says it rarely actually identifies a specific trigger in CEP cases, and even if it did, most dogs still end up needing steroid treatment anyway, and they reiterate doing thorough fecal exams to keep looking for parasites.
What if you look at the tissue itself, like a biopsy?
Pathologic findings, yeah. If tissue is examined, either from biopsy or, unfortunately, post-mortem, it gives more detail. Grossly, just looking at it, the lungs might have diffuse or patchy firm areas, maybe nodular, often looking pale or mottled.
And under the microscope.
Histopathology confirms the infiltration of those eosinophils, along with other inflammatory cells like lymphocytes and macrophages. In chronic cases, you can see scarring fibrosis and those granulomas. The source also notes the lining of the upper airways can sometimes show changes too.
Okay, clearly a complex diagnosis. So once you have the diagnosis, how is CEP treated and managed based on this material?
Treatment starts with just good supportive care. If the dog is really sick, not eating, losing weight, very lethargic, the source recommends starting treatment in the hospital.
Makes sense. What does that involve?
Things like making sure they're well hydrated, because dehydration makes it harder to clear mucus, giving supplemental oxygen if they're having trouble breathing, and keeping them quiet, restricting activity, especially early on.
Any special diet needed?
Not specifically mentioned, other than just ensuring they maintain a normal intake and body condition. Client education is also stressed as important.
Telling the owner what to expect.
Yes, and warning them about the risks, especially if the dog has severe hypoxemia, low oxygen levels. It can be serious.
Is surgery ever an option?
Rarely, but yes. The source mentions if there are very large, distinct granulomas, surgically removing that lobe of the lung, a lung lobectomy, might be considered.
But mostly it's medication, right? What's the main approach?
Absolutely. Medication is the core. The source is clear. The drug of choice is corticosteroids. Prednisone or prednisolone.
Steroids. Okay, how are they used?
Typically, you start with a fairly high dose, like 2 milligrams per kilogram per day. You continue that until the clinical signs, the cough, the breathing difficulty get better. That usually takes about 2 to 3 weeks.
Okay, a few weeks on a high dose.
But then, and this is really important, you have to taper the dose down very slowly. We're talking over months.
Months, wow. Not just a quick course then.
Definitely not. The source explicitly says many dogs need long-term maintenance therapy with steroids. Sometimes for 4 to 6 months, maybe even longer. The maintenance dose is much lower, maybe given every other day or even just twice a week.
So it's often about long-term management. not necessarily a cure.
That seems to be the case for many, yes. The source does mention inhaled corticosteroids, like fluticasone, as an option for long-term use.
Delivered how?
Usually with a special spacer device and a face mask. This can help reduce the side effects you might get from long-term oral steroids, or it might be used after the initial phase once things are more stable.
What about antibiotics? You mentioned secondary infections.
Only if you've proven there's an active bacterial infection, usually from that BAL culture. The source strongly advises against using antibiotics just in case prophylactic use because of the risk of antibiotic resistance.
Right. And if the dog has heartworm disease too.
Then you do need to treat the heartworm infection itself with adulticidal therapy. But critically, the source says you only start that after the dog's lung inflammation is stabilized with the corticosteroids and rest.
Why the delay?
Because killing the adult worms can sometimes cause its own inflammation or complications like clots, so you want the lungs as stable as possible first.
Okay. Any other meds? What if it's fungal or allergic?
Antifungals, like itraconazole, are used only if a fungal infection is actually confirmed. And if an allergy is identified, allergy shots hyposensitization can be tried. But again, the source suggests it's not the main treatment, and most dogs still need steroids.
What if steroids don't work well or cause too many problems?
Other immunosuppressants, like cyclosporine, are mentioned as possibilities, but the source kind of prefers inhaled steroids as the alternative if possible, and notes there isn't a lot of trial data for cyclosporine in CEPs specifically. Oh, and bronchodilators, drugs to open the airways, can be helpful if there's wheezing or obvious airway constriction.
So steroids are the mainstay, often long-term. How do you know if the treatment is working? How's it monitored?
Monitoring is key. Blood work, the CBC, should show those eosinophil or neutrophil counts coming back to normal if they were high. But the source really emphasizes that arterial blood gas analysis is the most sensitive way to track lung function.
Even more than how the dog seems.
Well, interestingly, the source notes that the blood gas numbers might stay abnormal even when the dog is clinically doing much better and the disease is considered well managed. So it's sensitive, but doesn't always perfectly match the clinical picture later on.
It's interesting. What else for monitoring?
Listening to the lungs regularly, of course. And chest x-rays are monitored too. But the source points out that the changes on the x-ray usually improve more slowly than the dog's actual symptoms do.
Good to keep in mind that lag between feeling better and the x-ray looking better. Can CEP be prevented?
Well, given the causes, routine heartworm prevention is a huge factor. That directly addresses the heartworm microfilaria trigger.
Absolutely essential.
And if you suspect an environmental allergen, the source suggests trying to change the dog's environment, reducing dust, mold exposure, things like that.
Makes sense. Any complications to watch out for during treatment?
The main one mentioned is pulmonary embolization, blood clots in the lungs, specifically as a risk for dogs being treated for the adult heartworm infection.
Right, that ties back to stabilizing them first. So finally, what's the overall outlook? The prognosis.
For mild to moderate cases, the source says the prognosis is generally good, but like we discussed, many dogs do need that long-term steroid therapy.
It's a commitment.
It is. The prognosis is thought to be better if you can find a specific allergen and remove it, but that's often not possible. For dogs with heartworm-related CEP, the outcome also depends on how severe any secondary heart issues or clots are. And for that eosinophilic granulomatosis pattern, the one with nodules, the prognosis is more guarded. That form is often progressive.
Wow, okay, that was a really thorough exploration of canine eosinophilic pneumonia based purely on the source material provided. We've gone through what it is, this immune-mediated lung inflammation with eosinophils.
How it can be triggered by inhaled allergens or parasites like heartworm.
The really variable signs, the lack of fever often being a clue.
The complex diagnostic path, ruling things out using blood tests, imaging, and especially that BL cytology to confirm.
And the treatment, heavily reliant on corticosteroids, often for the long term, plus the importance of heartworm prevention.
Yeah, it covers a lot of ground.
It really does.
Yeah.
So maybe a final thought for you, our listener, to chew on. Given that CEP is fundamentally about the immune system's reaction, often to things in the environment, and requires such careful long-term management, what does this condition really tell us about that intricate ongoing dance between a dog's surroundings, their internal immune balance, and the reality of managing chronic illness?
It certainly highlights how interconnected everything is. Environment, immunity, health. It's complex.
Definitely something to think about. Thanks for joining us for this deep dive.
My pleasure. Always interesting.